Indication and selection of TDT, thalassemia patients for transplant of gene therapy is a quite complicated topic, because nowadays we are having, luckily, many curative options for these patients. Of course, the possibility of referring one patient for a curative option must be weighted with the the other possibility of conservative conventional treatment, which anyway is giving improving result. Patients are now surviving up to their 50s or 60s or even more, although they start to experience some important complication from adolescence and adulthood. So we really need to weigh the potential of a cure through allogeneic stem cell and gene therapies with the risk associated with this type of treatment, and compare this with the outcome that nowadays we have with conventional treatment. And the other aspect is to select the right treatment for the right patients. Young patients who have a matched sibling donor, they have excellent outcome with allogeneic stem cell transplantation. So in this case, the patients can be referred for this type of option, but it must be carefully discussed with the families, especially for what are the risk of graft failure, GvHD, the immune-mediated risk, which are something that is specific to the allogenic setting, and of course the risk for infertility. Patients above the age of 14 instead can be considered for autologous gene therapies, provided that this is approved and reimbursed in the country of origin of the patient. And in this case, of course, the patient is in an age range in which he or she may start experiencing some important complication, or may have a higher iron overload as compared to childhood. So in this case, the selection can be a little bit more complicated, because not all the patients, despite having a treatment which has the possibility to cure all of them, are not really eligible for that treatment, because they already have some comorbidities or an excess of iron overload, which prevent them to be true candidate for these therapies. So it's very important to consider this factor in selecting the right patient for this therapy, and improving also the conventional management already in these years, in order to not to be in the condition to treat as many patients as possible in the future. Otherwise, we will run the risk that some patients, despite having an approved therapy available, cannot be treated because of an excess of comorbidities.